25% of adults have a flap-like congenital defect in the partition that separates the two upper chambers of the heart. This defect may allow small blood clots that would normally be filtered by the lungs to pass directly into the brain or other organs, causing a stroke or a mini-stroke. This defect is also associated with migraine headaches. Board-certified cardiologists Drs. Nat Sanderson and Charles Rabinowitz of South Texas Cardiovascular Consultants tells us about a minimally invasive treatment that can close this defect in the heart.
Patients with this defect may have a mini-stroke or a TIA, which is a transient ischemic attack, that may be a prelude to a major stroke. The symptoms of these TIAs and mini-strokes include sudden onset of numbness in the face, arm, and leg, confusion, difficulty speaking, difficulty understanding, trouble seeing, difficulty walking, dizziness, balance problems, or a sudden onset of a headache.
Let's find out how they diagnose this defect and why treatment is so important.
This defect can be detected by a variety of different ultrasound studies of the heart. However, the most sensitive way to detect this defect is an ultrasound of the blood vessels that go to the brain while injecting a specialized saline solution. Treatment of this defect is very important to prevent a major stroke, remembering that after the first stroke, the recurrence rate is anywhere from 2 to 9%. After a second stroke, it's anywhere from 6 to 20%. In the case of migraine, relief occurs in 80% of the selected cases. Now let's talk about treatment options.
So one of the options for treatment is medication. This would include antiplatelet or anticoagulation therapy that a patient would have to take for the rest of their life. This is suboptimal, however, due to the high recurrence rate of somewhere between 2 and 9% each year for another stroke. The best option is a minimally invasive procedure where we actually close the defect, and this results in a less than 1% per year recurrence rate for stroke. Closure of the defect is achieved by placing a device across the hole in the catheterization laboratory in a low-risk, minimally invasive procedure. Typically, the patient stays in the hospital less than 24 hours.
At South Texas Cardiovascular Consultants, you'll find experience that counts, dedication that matters, and the finest preventative diagnostic and treatment options available for heart disease.
American Health Front is a production of Medical Media Group and 2010 Productions.